Hello, good morning, everyone. Today I'm going to talk about what type of pain can be treated by acupuncture. As you can see on the screen, pain. There are actually in clinical practice there are varieties of different type of pains. From the perspective of acupuncture, the pain is a signal of imbalance sent by the body. Traditional Chinese medicine hold that pain arises when there is obstructions, and pain arises when there is deficiency, which emphasize that the core pain lies in the disrupted flow. Um, and acupuncture works by stimulating the specific acupoints to regulate qi and blood, to balance yin and yang, and to restore overall health. Mm, the acupuncture works by stimulating the specific acupoints to regulate qi and blood, to balance yin and yang, and to restore overall health. So now I'm going to talk about the first musculoskeletal pain, including neck and shoulder, back, and limb pain. Conditions such as cervical spine spondylosis, lumbar disc herniation, osteoarthritis, frozen shoulder, muscle strength after intense exercise, or other type of pains. Acupuncture is a treatment option for those who do not achieve adequate relief from physiotherapy, massage, or medication, and for patients who prefer to avoid or cannot undergo surgery. And the second type of pain is neuropath, neuropanic, pathogenic, neuropathic pain. For example, it's called postherpetic neuralgia. Um, um, so um, so using the needles, it combined with for example the points on the like a different meridian, it can significantly reduce the pain. And especially studies shows that the early intervention will reduce the risk of long-term complications. And then the next one will be uh, trigeminal neuralgia. Usually, it's like a characteristic character characterized by sudden electric shock, or tearing facial pain, which can be triggered by activities such as brushing teeth, washing the face, or eating. clinical practice has shown that acupoints such as 下关、四白, and 合谷 can effectively regulate the trigeminal neuralgia. Acupuncture is also effective for toothache and post-teeth extraction pain. And the next very popular or common one is called sciatica. So often caused by for example, lumbar disc herniation. And when the so when the protruding nerve compresses, the protruding nucleus compresses the nerve root, or the other causes like including lumbar spinal stenosis or spondylolisthesis, or bone spurs, or performance syndrome, where tight or spastic piriformis muscle irritate the sciatic nerve. So acupuncture can help relieve these symptoms. Um, and then the next one is headache. So during the acute attack, the goal is rapid pain relief. Acupuncture intensively may be slightly higher, with needle retention of approximately 20 to 30 minutes, and the bloodletting along the collaterals often provide immediate relief. During the relief and the prevention phase, treatment focus on regulating constitution and reducing recurrence. Frequency is usually 2 to 3 sessions per week, often combined with moxibustion, including the points, for example, 百会 or 足三里 to warm and nourish the qi and blood. The fourth one is called a visceral pain. So acupuncture can serve as not only as an emergency treatment for menstrual pain, but also in the long term regulate the menstrual cycle and to prevent recurrence. So the functional of the abdominal pain, like for example, abdominal pain is one of the most common clinical symptoms, including multiple internal organs. Acupuncture and with its has holistic regulation has unique advantages in rapidly relieving both acute and chronic functional abdominal pain with high safety and efficiency. Um, so and also there is another one is actually the pain of unknown origin. The chronic pain without a clear cause, despite extensive medical examinations, can also be addressed with acupuncture due to its ability to regulate the body's overall balance and relieve discomfort. So that is today's topic about what type of the pain can be treated by acupuncture. I'll see if I can find any small videos.
Acupuncture is very useful for conditions like migraine and headache or cervicogenic headache that comes from the neck. It's very useful for muscle shortening conditions like low back pain, spasm generally. So very useful for athletes and people trying to keep fit. Also for older people who suffer from muscle stiffness.
I was born in China. I have both Western medical degree and a PhD of the Chinese medicine too. Acupuncture is one branch of holistic medicine. According to the Oriental medicine, acupuncture actually can treat a lot of symptoms and conditions. Lower back pain, shoulder pain, neck pain, more than 95% success rate. Muscle atrophy, Bell palsy, PTSD. Even we treat infertility, very effective.
I have had chronic lower back pain since I was 17 years old. When Dr. Fu came available, I ran quickly. I come in dressed as I am. It's a 30-minute to 60-minute session, depending. It's a holistic, it's a whole body experience.
I was in a little car accident and just wasn't nothing working. The pain, like my neck was stiff. I got tired of medication. I was at the point I tried everything else. Might as well. And I like it.
Different acupuncturists, they use different kind of method. For me, I basically using needle. If we talk about the needle, we talk about you have some kind of sensation. But hurt, I don't think so.
I'm scared to death of needles. You don't feel it?
It's not painful at all. Oh, a needle hurt? No, it's not painful at all.
With Dr. Fu, you're going for treating not just the symptoms, but getting to the cause, the root. With the chronic lower back pain, that was resolved.
I can make it through the day without taking the Tylenol or taking the Proxen.
I can scoop up my 2-year-old granddaughter. I can chase her, I can play, I can get up and off the floor with her. I can't say enough about it. I'm going to cry because I've never been pain-free.
What is my happiness? What is my excitement? It's my patient to tell you, oh, doctor, you are so good. You have a magic hand. No, it's not my magic hand. It's the needle is good.
Igor is the coach, so he bought a dot coach domain name with square.
If you've been considering acupuncture or you have been referred for it, you might be wondering what to expect. In this short video, we're going to cover what acupuncture is, how it works, what it's used for, what to expect during a session, and potential risks as well as safety considerations. So first of all, what exactly is acupuncture? Well, acupuncture is a treatment that comes from traditional Chinese medicine. It involves inserting very fine needles into specific points of the body for therapeutic or preventative purposes. In the UK, it's used by some GP practices and pain clinics, and it's also commonly offered by physiotherapists. Now, there are two main approaches to acupuncture. Traditional acupuncture is based on the idea that an energy or life force known as qi flows through your body along channels called meridians. If this flow is blocked or disrupted, traditional practitioners believe that this can lead to illness, and acupuncture is used to help restore flow of qi and improve your health. Now, Western medical acupuncture, sometimes called dry needling, takes a slightly different approach. Here, the idea is that inserting needles into specific points stimulates sensory nerves under the skin and muscles, which can trigger the release of natural substances like endorphins, your body's own painkillers. This might help explain some of the therapeutic effects that people report. So what kinds of problems is acupuncture used for? Well, the National Institute for Health and Care Excellence, or NICE, currently recommends acupuncture in the NHS for certain conditions, including chronic pain, chronic tension type headaches, and migraines. It is sometimes also used to treat joint and muscle pain, as well as jaw pain and symptoms of cancer or side effects of cancer treatment, as well as feeling sick after surgery or chemotherapy, prostatitis symptoms, as well as persistent hiccups, for example. Now, although it's used for many conditions, the evidence for how well acupuncture works can vary, and for many uses, it's still considered a complementary therapy. Again, this is going to vary from person to person, and each individual is going to find different benefits from acupuncture. So what can you expect if you go for acupuncture? Well, an initial session usually lasts between 20 minutes to an hour. Your practitioner will take a full history of your symptoms and assess your general health. You may also have a physical examination. Then they'll decide which acupuncture points to use and insert very fine needles into specific areas of your body. The needles may go just under the skin or a bit deeper into the muscle, depending on the condition being treated. Once in place, the needles might be left in for anything from a few minutes up to 30 minutes. Now, most people don't find the process painful. You might feel a slight tingling or dull ache when the needles go in, but this should pass quickly. If you do feel pain, let your practitioner know straight away. Now, courses of treatment usually involve several sessions, and it can take a few appointments before you begin to notice any benefits. So now let's briefly touch on safety and potential risks. So when carried out by a qualified practitioner, acupuncture is generally considered to be safe. Mild side effects are fairly common and might include slight bleeding, bruising, feeling drowsy, or lightheadedness. Serious complications like infections or punctured lungs are very rare. Acupuncture is generally safe during pregnancy, but some acupuncture points are avoided, so always let your practitioner know if you are pregnant. If you've got a bleeding disorder, take anticoagulants, or have a metal allergy, it's important to tell your doctor or practitioner beforehand. Now, these aren't all of the potential risks, and so it's really important to discuss them all with your own health practitioner before undergoing any treatment. Finally, acupuncture is not currently regulated in England, so if you're seeking treatment privately, it's recommended to see someone who's a regulated healthcare professional like a doctor, nurse, or physiotherapist, or a registered member of an accredited acupuncture body. Thanks for watching, and for more details, including how to find a qualified acupuncturist, please check the links in the description box of this video. As always, if you've got any questions, do speak with your own healthcare provider, because this is an educational video only. Thanks for watching, and until next time, bye.
Thank you guys for your watching. That is today's introduction for what type of pain acupuncture can treat, and we'll see you next time.